So one of the nice things about in vitro fertilization compared to other types of medicine is that there are very definable outcomes. Patients can actually look up verifiable audited data from either SART, the Society for Assisted Reproductive Technology, or the CDC, Center for Disease Control, so cdc.gov or sart.org. And there it's nice because what they can do is take in all of this data from the entire nation. So it's about 140, 150,000 cycles per year, and see how the data plays out in each age group. And it's reported in a uniform fashion so that it makes kind of a lot of sense for patients. For example, let's say there's a 37-year-old that has endometriosis. The patient could log on to the SART site and place in that information that she's 37, that she has endometriosis, and then she'd find out the success rates for all of the patients between 35 and 37 that have that particular diagnosis in the United States. Not only is there national data, but there are individual clinic data sheets that are generated. So a patient could look in the particular state she lives in and take a look at all of the success rates and the track record of all the clinics there, how many years they've been around, how many cycles they're doing, etc. The way we typically define success is live birth per initiated cycle. You really shouldn't compare clinic to clinic because patient populations could vary. For example, if clinic A decides, well, we're only going to take in the most easy patients, patients that have never gone through IVF, that have all these different parameters that are very favorable, and another clinic decides that, well, we're going to treat everyone. We're going to treat all those that have failed at other places. We're going to treat those that are very difficult cases. It wouldn't really be fair to compare clinic A to clinic B in that case, but you can compare your data to the national average. And for example, there are ways to query things like diminished ovarian reserve. You can do that between one clinic and the national average and so forth. That's quite helpful.